Mr. Hughes, my friend Rajendra, respected Dr. Professor Murali Manohar Joshi, Mr. Sripad Nayak, ladies and gentlemen. I would like to congratulate Rajendra for coming up with this wonderful book. I wish he wrote this book at least 10 years earlier. We could have avoided the current problem we are facing. I am very optimistic that within the next 10 years, India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. I have some suggestions for the galaxy of policymakers as well as the opinion makers in healthcare. I have been practicing cardiac surgery in this country for now 26 years. I have been actively involved with rural healthcare from my days in the medical school. So I have certain observations, suggestions, some practical points. Improving cardiac surgery, cardiology, or cancer surgery is not going to improve the healthcare of this country. That is required for a tiny, tiny percentage of the population. If we want better healthcare to this country, we have to concentrate on rural India. They should have access to healthcare at a price what they can afford or preferably free of cost. Now, we have been trying to deliver healthcare to rural India for the last close to 70 years without much luck. The model itself is flawed. First, let's look at the primary health center in India. There are 50,000 primary health centers in India, and there are over 1.5 lakh sub-centers. And these centers are supposed to be run by a doctor with the title of MBBS. Unfortunately, he is not there. The absenteeism is nearly 50%, and the 50% who are present, they are present only for a few hours. Because I have interacted with over 50,000 young doctors who are graduating or who have just graduated. I am yet to come across a single doctor who has expressed his desire to work in the primary health center. When young people join the medical college, they have an aspiration to become specialists. There is no point in trying to make it compulsory and punish them. When their heart is not there, there is no point in driving them. But we have an option. All over the world, primary health care is not provided by doctors with MBBS degree. We produce over 20,000 Ayush doctors. These doctors are trained like us by the same university. All you need is 6 months of bridge course, and all they need to do is to prescribe 47 basic drugs. And if we can do that, these doctors can run primary health center. This is the extreme model of primary health center which we are building in the state of Rajasthan. It's an abandoned shipping container. With 5 lakh rupees, you can equip this center and have a digital healthcare service. It's a joint venture between us and Hewlett-Packard. So essentially, in these clinics, you can do 8 common tests without using the wet chemistry, and you can offer primary healthcare to virtually every problem. And unless we change the regulation to empower Ayush doctors, Ayurvedic doctors to prescribe 47 allopathic drugs, we are not going to have primary health care delivered to the rural India. It is as clear as that. But last 10 years, we have sat on several committees, made several recommendations. We don't know in the end that is not happening as a law. Every 10 minutes, a pregnant lady dies somewhere in India during childbirth. 3 lakh children die the day they are born. 1.2 million children die before celebrating the first birthday. Why this is happening? It is happening because 60% of the childbirth happens in rural India. We produce 26 million babies a year. Conservatively, we need to do 5.6 million cesarean sections per year. To do that many cesarean sections, we need 2 lakh gynecologists. We have about 30,000 gynecologists, half of them don't practice obstetrics. They are all in the cities. We need 2 lakh anesthetists, and we have about 40,000 anesthetists. We need 2 lakh pediatricians. We again have 40,000 pediatricians. We don't even have more than 30,000 radiologists. And government data shows that the vacancy in community health center, where 60% of the children of this country have to be born, is close to 80%. Because law of the country today doesn't allow anyone other than a postgraduate qualification to anesthetize a patient or do a cesarean section. I'm a cardiac surgeon. If I do a cesarean section, I will lose my license. If I do a chest X-ray, I can lose my license because I'm not licensed. So we have created the first world regulatory structure with third world infrastructure. So only option we have is to train more medical specialists. How can you do that? We are today dependent on medical colleges. There is an organization called College of Physicians and Surgeons in Maharashtra, CPS. This university was established 105 years ago during British era to address the rural healthcare needs of the country. They conduct 2-year diploma courses in gynecology, anesthesia, radiology, and pediatrics. Over 50,000 doctors who are joining today government service as MBBS doctors, today they are retiring as MBBS doctors. There is no career progression. All those doctors can be converted as diploma in gynecology or pediatrics or any of those fields in 2 years' time. We don't need a medical school to produce these intermediate level specialists. There is a university waiting to do that. We have to just bring about a legal regulatory change. Till 10 years ago, their degree was recognized all over the country. But 10 years ago, Medical Council decided to de-recognize whatever reason. Today, their degree is recognized only in Maharashtra, Gujarat, and now in Rajasthan. Can Central Health Ministry make a policy that if they are going to fund the state governments to reduce the maternal mortality, how are they going to do it without a gynecologist, without anesthetist? It's not possible. And we have a solution. We don't need to come up with a new institution. Now let's look at the top 10 causes of death in India. The number 1 cause of death, heart disease. Number 2 cause, diarrheal disease, mainly children. Then lung disease, brain stroke, TB, mental depression, accidents, liver disease. These are the top 10 causes of death. Now, can we bring down the top 10 causes of death? We can never bring down the causes of death unless we reform the medical education. None of those diseases can be treated by a doctor with MBBS degree. To treat these top 10 causes of death legally in this country, you need medical specialists. When the requirement of cardiologists in the country is about 60,000, we have some 4,000 cardiologists. And they will refuse to go to even 20 kilometers away from the capital city. Now, why we are in this mess? We are in this mess because all the developed countries, why they have better healthcare? Look at US. They have 19,000 undergraduation seats in medical colleges. And they have close to 40,000 post-graduation seats across the United States. We have 56,000 undergraduation seats in medical colleges, and we only have 14,500 post-graduation seats. We are not even replacing the senior doctors who are retiring, leave alone producing more doctors. Then we are talking about offering healthcare to everyone. It is not going to happen. We have to change our idea about what postgraduate medical education is. When we talk to the policymakers saying that we have to increase the number of post-graduation seats, the common answer given is we are short of teachers. Now, what is the definition of a teacher? all over the world, any surgeon who has practiced for 5 years can be a teacher. In our country, let's look at cardiac surgery. You all know, you're from Delhi, Dr. Naresh Trihan. According to the Medical Council regulation, Dr. Naresh Trihan can't be a teacher in cardiac surgery. Dr. Panda from Bombay, one of the famous heart surgeons, according to Medical Council law, he can't be a teacher. If the people who are stalwarts of cardiac surgery cannot be a teacher, then who can be a teacher? There is something wrong with these policies. We have to address it. We can't wish these problems away. Let's look at the nursing services. I am predicting within 5 years, most hospitals in India will close down because there will not be nurses. Admission to nursing colleges across the country has come down by 50%. And half the nursing colleges are closing down. Why? Why nursing profession has lost the glamour? It is because there is no career progression for a nurse in this country. A nurse who gets a BSc, she may do MSc, but she can't do anything more than what she is doing as a BSc. In United States, 67% of anesthesia is given by nurse anesthetist. In India, who was a nurse who has worked in critical care unit for 20 years is legally not allowed to prescribe a paracetamol tablet. If we do not give career progression for the nurses, young girls will never take up nursing. And in the end, what will happen? A doctor is there with the patient. Statistically, a doctor in a hospital doesn't spend more than 1% of his time with the patient. 99% of the time, an inpatient is with the nurses. So this is the state of nursing education. Unless we take action to empower the nurses and allow them to become nurse intensivists, nurse anesthetists, and nurse practitioners, this profession will die. Let's look at behind every healthcare is not about doctors. Healthcare is about doctors, nurses, medical technicians, home health aid. Behind every doctor, there are at least 6 non-doctors taking care of the patient. And they are the ones who make doctor more efficient, and they are the ones who will spend time with the patient and explain to them. They are the ones who will make healthcare effective. Let's look at US. Out of the 20 fastest growing occupations in US, 15 are in healthcare. In the US, last 8 years, only industry which created job is the healthcare industry. As every industry matures, it requires less and less number of people. But healthcare industry, as it matures, it requires more and more number of people because we are adding new specialties that requires different set of skills. But unfortunately, out of the 15 fastest growing occupations in India, none of the 15 training programs exist in the country. Forget about giving them encouragement. Those training programs just doesn't exist. Then we are having strategies to create a huge labor force. The greatest threat to this country is not going to be external aggression. It is going to be 300 million youth who will not have a job, who are looking for a respectable job which is well paying. When they don't find it, they will destroy the country. And you can't give skill to 25, 30-year-old people. We have to start planning now. Let's look at IT industry. IT industry gets phenomenal benefits from the government. They get land virtually free, they don't pay income taxes. For 1 crore rupees turnover per month in IT industry, they just require 5 to 7 people. And these are the engineers who come from middle class, upper middle class families. Look at healthcare industry. For 1 crore rupees turnover per month in healthcare industry, we need to hire 250 people. That is the power of healthcare industry, which can create massive jobs, and it can emerge as the largest employer in the country. NHS of United Kingdom, which is serving some 50 million people, is the world's third or fourth largest employer. Imagine if healthcare blossoms in India, that is going to be the main driver of economy of this country. Now, for all this to happen, how are we going to fund it? Is taxpayers' money going to fund the healthcare? It is unlikely, because nearly 70 years after the independence, we haven't been able to spend more than 1.1% of the GDP on healthcare. This is our problem. Now, where is the money coming from? Around 12 years ago, we convinced our government of Karnataka to launch a health insurance for the farmers. In the first year, we had 17 lakh farmers who agreed to pay 5 rupees. Today, we have 45 lakh farmers paying 20 rupees per month for the health care. And we network with 400 hospitals across the state of Karnataka. And in 10 years, close to 1 million, that's 10 lakh farmers had varieties of surgeries. And close to 1 lakh farmers had a heart operation. All this happened by just 5 rupees per month. We have close to 900 million mobile phone subscribers who are spending 150 to 200 rupees per month just to speak on the mobile phone. If we can have a policy that every mobile phone subscriber must pay 20 rupees every month with his mobile phone bill, we can cover the surgical cost of 900 million people. And this is the advantage of a country with 1.2 billion population. And this can be done with hardly any investment in the infrastructure, because mobile phone companies have already built the infrastructure. Now, when this massive transformation, when it happens, we need to build hospitals in tier 2, tier 3 cities. The cost of building a specialty hospital in city or in small town is the same, barring the land cost. Now, how do you reduce the cost? So we produce a model in Mysore, which is a tier 2 city. Our intention was to build and equip a 300-bed super specialty hospital for $6 million, about 45 crore rupees, which is about 25% of what it normally costs. It takes about 2 to 3 years to build this kind of a hospital, but we wanted to build it in 6 months. Because when you deploy the capital, you need to see the returns at the earliest. So we took L&T, the L&T India's one of the best construction company, took the contract, and sure enough, we did it. We couldn't build it with $6 million, we spent $7 million. We took 9 months to build, it could have been done in 6 months. Now, is it important that a hospital should have a central air conditioning? It is not required. We live in a tropical country. My house is not centrally air conditioned. Why should a hospital be centrally air conditioned? Of course, you need central air conditioning in the operating room, ICUs, for the patient's comfort and for a dust-free environment. There are many ways we can reduce our cost, and these are the models which can produce. Online healthcare is going to be much easier to deliver than online retail. And believe me, within the next 10 years, smart software will make smarter diagnosis than doctors. This transformation will happen in 5 years, 6 years. Within 10 years, believe me, there will be a law which will mandate doctors to get a second opinion from the software before starting the treatment. This is the reality. It is better we accept. Now, for this to happen, we need a regulatory infrastructure for an online healthcare. Today in India, there are over 200 million smartphone subscribers. And it is a matter of time before all the feature phones will be replaced by a smartphone. Why a diabetic patient go to see a doctor every month? What does the doctor do? If he is going to examine a diabetic patient, is he going to find any new findings? Okay, first consultation is important. Why should a child who is seen by a pediatrician, every few months in India, kids develop chest infection, cold, cough. Why should they go and stand in a long queue in a government or a private hospital, get all kinds of resistant bugs from other kids? It is not required. So, if the patient doesn't need operation, doctor need not touch the patient. If I don't need to touch the patient, patient can be anywhere. So we believe that online healthcare will dramatically transform the way healthcare is delivered. For all that to happen, we need a regulatory structure empowering doctors about do's and don'ts and protect them legally. Interestingly, in India today, 60 to 65% of the medical students are young ladies. And these ladies, for them, family is more important than their practice. So as soon as they get married, when they have children, they don't want to work. They are pediatricians, radiologists, dermatologists, pathologists, they are at home. If we can have a framework for all these pediatricians, radiologists, women to offer healthcare to people at home, we can dramatically bring few thousand medical specialists online who are available. Now, as doctors, we may feel insecure. We may influence the policymakers that we shouldn't allow that, because when we want to protect our turf, we won't say that it is not good for me. We tell you that it is not safe for the patient. And as policymakers, you'll be scared. If you don't do it, believe me, doctors from Bangladesh, Pakistan and Afghanistan will start treating diabetic patients, children from this country. It is going to happen. Nobody can come on the way of online healthcare. It is going to happen. In the end, I just want to end my talk stating that we have a phenomenal opportunity to change the rural landscape. If we want a better country, we need to empower women. To empower women, we have to create jobs. As an organization, we have close to 15,000 employees across the country. At one point of time, 90% of our employees were women. Why give the job to a woman when we all feel that a man can do a better job in a hospital? Let's look at the job of cleaning the floor. If I give the job to a man and give him 8,000 rupees salary, he will spend 4,000 rupees on himself and 4,000 rupees goes to the family's welfare. Instead, I give the job to his wife and give her 8,000 rupees salary. She will spend entire 8,000 rupees on family's welfare. And a woman who comes from lower socio-economic strata, when she is employed, she becomes an empowered woman. And empowered women will discipline the children. She is no more a doormat. Husband cannot bully her. She is a confident woman. And these confident women will teach the children the art of making choices. Why some people become successful, some people fail? Because when they were children, they were not taught the art of making choices. And when these women are empowered, they bring up children who will become confident adults who will build a great nation. Now let's look at the healthcare industry. We have hospitals doing hernia, hydrocele operations, simple procedures. We blindly follow the regulations of US and Europe. To assist for an operation, we need somebody with the BSc in nursing. Do you really need somebody with the BSc in nursing? Any girl with some intelligence can be trained to do those tasks. These are repetitive tasks, and they will be willing to do it with great passion. This is a beautiful painting in my office. And anybody walking into my office look at the painting and they ask me a question. Who did this painting? And I ask the same question to all of you. Can you guess who did the painting? This painting, this beautiful painting was painted by a trained elephant in Thailand. If we can train elephants to do this beautiful painting, can't we train village girls to hand over a surgical instrument when somebody is doing a hernia operation? It is possible. But we need to have a different kind of a mindset. In the end, I just want to end my talk with the greatest optimism that India will definitely become the first country in the world to dissociate healthcare from affluence, because we are blessed in having wonderful people, great souls, who want something better to happen to all of us. Thank you very much for patient hearing. I'm extremely grateful to all of you. Thank you.